Hello, everyone. So Lou Piero is here to present to the full board this concept of Everhome. It was brought to County OFA's office in reference to what they can do or how they can assist in the county and how they can help our community members. There were some questions, some concerns. I think, if I'm not mistaken, Lou's presented at least twice. This is maybe the third time he's presented. Is Greg Olson on by any chance? Lou, is Greg Olson coming? Is he on?
I thought he was being invited, but I don't see him on.
Okay, so Greg Olson is the state director, if I'm not mistaken, for the state OFA. This is a pilot program. We met with Greg Olson. He also presented to a small group of my committee in reference to Q&A. The county's only involvement with this would be that the county OFA's office would be, it would be just another service that we would offer, no differently than a lot of the other services that we have. Lou is here to answer any questions and present what it is that Everhome can do for the county. After spending a lot of time trying to get to understand what this can do, it seems to me it's the future of what medicine is going to be. The state's very much behind it. They want to see if this program works. They chose Columbia County. There's a couple of $100,000 that the state OFA has offered to the county if we use any of our services. So if Everhome feels that there is something that would be beneficial to someone in the county that the county's already offering, for instance, Meals on Wheels, we would get paid through that money. So I'm going to kick it back to Lou, who can present his company and this pilot program, which is a non-for-profit now. Any questions anybody has, please ask. Thank you, Lou. Thanks for coming, and thanks for everybody else for coming. We appreciate it very much.
Thank you, Rob. And thank everyone for their time tonight. We're going to give a brief presentation and then open it up so that we can answer any questions that any of you have regarding the pilot program. But the pilot is being conducted by Everhome Columbia, Inc., which is a 501c3 entity, a not-for-profit. And it's going to be run under the direction of a board. I did provide the pilot detailed summary to everyone and responses to a number of questions, which included description of the board and the board members. I'll talk a little bit about some of them. One of them happens to be on the call tonight, PJ. So the not-for-profit evolved from a conversation that we had with the Home for the Aged. And for those of you unfamiliar with the Home for the Aged, we call it HFA. It's an organization that's been in Columbia County for 130 years. They ran a facility, an adult home, which was great care while it lasted, but they were unable to continue that care in the facility, which is up on Union Street. So they sold it and they received a decent amount of money, and they have a mission. The HFA mission is to support seniors in Columbia County and to provide them with services. So HFA had a mission that was without a method. So they didn't really have a way to fulfill their mission because they couldn't provide the care that they provided in an adult home. And so they were looking for an opportunity to evolve their mission. So we had several meetings with them, and the chair of the Home for the Aged board is Carl Whitbeck. And they have a number of board members that you're probably familiar with: Bill Gerlach, Joan Coeek. Who am I leaving out? They have 7 board members. And so we went through a number of presentations with them, and together we conceptualized this pilot program. And the goal of the pilot is to take what is right now very antiquated home care methods and to bring them up to date in terms of technology and create what their new mission is. The HFA new mission is virtual homes for the aged. So rather than people having to displace and leave their home to go to a nursing home or an assisted living facility, The idea here is that we want to build a plan around the individual in their home that will allow them to stay in that home in the ideal setting for life. So it's helping people age in place and bringing to them the services that they need to age in place. I like to say the old saying was, it takes a village to raise a child. Well, today it takes a village to care for an elder. And so when we look at this care, the one critical deficiency right now, for those of you, and I know many of you are actually in this field, the one critical problem that we face is there just aren't enough home health aides to staff the number of cases that are out there. This is being written about every day in the papers. Congressman Delgado had an op-ed in the Register Star a few weeks ago where he's trying to get money through Congress to enhance salaries and wages for home care workers to try to build up that workforce. But the bottom line is there just aren't enough people to staff the need. And Kevin can talk about the waiting lists that people have in Columbia County to get home health care. It's a substantial amount of people in a very lengthy amount of time that they have to wait to get services. So the company that we bring to the table is Apollo Care, and the mission of Apollo Care is to innovate technology to allow people to age in place. So we approached the HFA with a plan to roll out a pilot that will feature the technology, which is an app, and you're going to hear more about the app from Alan Evans, who is our Vice President of Technology. He's developing the product as we speak. And so we've been pulling together all of the players, the stakeholders in the healthcare ecosystem, so that that home and that senior in that home, and we do have people with disabilities that are also being served by this pilot. So seniors and people with disabilities who have chronic care needs can get all the services that they need delivered to them seamlessly. And we can't create bodies for home health aides, but we can fill gaps where those home health aides should have been and aren't through the use of this technology. So we've been working very closely with Columbia Memorial Hospital because all of the hospitals in the country are now looking at ways that they can extend their services into the home. We had a meeting yesterday at CMH with Dr. Pope, who is the director of all of their outreach programs and their technology. And so we're working very closely with him and their tech people at bringing that hospital care into the home. They call it remote patient monitoring, and then continuing the monitoring through the app that you're going to hear about tonight. So Bev Turner is one of the members of our not-for-profit board. Bev is the head of social work at Columbia Memorial. That's a role that Nora used to hold at St. Peter's Hospital, Nora Barato, who you'll hear from in a bit. And Bev is part of our board, and she brought the social workers in. And the common problems that face every hospital discharge planner, every primary care social worker, are coordinating services and finding services and being able to deliver them and communicate with their patients in the home. So the hospital is a major player and a key player in this. We're also integrating and bringing in emergency medical services because obviously that's the linchpin between the home and the hospital. So EMS will be a part of this and will be linked in to the overall healthcare or home care ecosystem. Primary care physicians will have access to data and will be able to participate with us so that they can track their patients in their homes. And Rob mentioned the New York State Office for Aging, and we're very fortunate to have someone with a lot of vision at the head of the NYSOFA, and that's Greg Olson. Greg is we've been doing this for a few years now, and he's been part of the planning for the few years and came up and pledged $200,000 to Columbia County Office of Aging to support their participation in the pilot. We're also talking to the Department of Health because people who are on Medicaid should not be deprived of this service. So we're working to get it into the Medicaid program. And we're also working to get it into Medicare because ultimately this should be a universal benefit for people. It should be part of the healthcare system. The problem today is that the cost is so high that healthcare can't absorb it into traditional Medicare and Medicare Advantage plans. But we believe that the technology will lower that cost to the point where their cost savings from the case management in the home will offset the cost of the services that are being wrapped around and bundled and delivered into the home. So we're also working with Columbia County's Healthcare Consortium, headed by Claire Pardee, and Claire is also one of the board members of Everhome Columbia, Inc. And so we've assembled a group of statewide people. The chair of that board is Becky Prevey, and Becky is the head of the Area Association of Agencies on Aging, which the Columbia County office is part of, and Becky is a very, very strong advocate for home health care. So she'll be participating and leading the board through the pilot process. So we think we've assembled a very, very good board of on the app side and on the home care side. Everhome Columbia Inc. has a website. You can take a look at it. It's everhomecolumbia.org. So that's up and running at this point, and we're about to begin the process of public education. So educating people on how they can access this program. It is limited at this point to Columbia County, and we have only HFA to thank for that. HFA has put the money in to seed this pilot, and without them, this doesn't exist. We're not here. So it's Columbia County pilot today. What Greg Olson and Becky Prevey hope to do, if it's successful in Columbia County, is then branch it out and make it available to people across the state, because it's really creating a home care system and an ecosystem for healthcare in the home that doesn't exist today in New York or anywhere in the country for that matter. So we're very happy to be working with Kevin and his staff. We've been looking at protocols on how this would work and how referrals may be made. So we're going to be, again, advertising and putting out public forums and putting out information so people will hear about us that may be able to access NYSOFA and Office for Aging Services. And they will carefully look at their caseload and identify people who would benefit from this. And they have case managers that would then approach the Office of Aging client and see if they have any interest in the pilot. And if they do have interest in the pilot, then we would get a consent and we would speak with them about the pilot and how it may work for them. So we have with us tonight Nora Barato. Alan, I'm assuming, is in the 26 others that I see on the screen. So I'm going to turn it over to Alan at this point. And Al is going to talk about the app and how the app pulls all of these pieces of the healthcare puzzle together for people in their own homes.
So, Alan, before you get started, I just want to remind everybody we have a hard stop at 7:15.
Okay.
So just, okay, thank you.
Okay. Let me share. Let me know when everybody can see that.
I have it.
Okay.
You're good.
And you're seeing the flow chart?
Yes.
Okay, great. So as Lou mentioned, this application is in development. And so I don't want to talk at you guys about what this does. What I prefer to do is tell you how it would work for the users. And then I'll show you some graphical representations of how it's going to look and how it's going to work. We are in the middle of development, so we don't have a demo to show you today, but we do have some screenshots. So I'll try to take you through this fairly quickly. Just stop me if you have a question, but I really want to talk about the user experience and how it works for them in the home. Nora can jump in at any point to help clarify some of these points. But what we'll have a user do, a family member, and really this flow is really from the perspective of what we call a responsible family member. That individual within the family caregiving circle is responsible for most of the day-to-day activities of caring for that individual. So when they log into the Viva Links app, they're going to just see their entry screen, their home screen, and that's going to be a summary of the most important things they need to understand and see and do that day, how that individual is faring, how they're feeling, and then from an interactive standpoint, what does that caregiver need to do to support that caregiver's, that care recipient's needs. So they'll see the to-dos, they'll see care notes, they'll see activities, And then they'll actually begin to enter information because they may be responsible for, that half a day or that day. So how is that individual feeling? Are they sad? Are they happy? Are they in pain? We would use a pain scale. What's the status of the particular condition that they're experiencing? What's their mental state? And then how are they, kind of navigating the activities of daily living? Are they able to cook and clean and take care of themselves? So most critically, then view their daily schedule. What is happening that day? They'll see that. They'll have the ability then, if they need to make a new appointment, they can do that. If they need to edit or change an appointment, need to change the time, or they need to cancel an appointment, they'll be able to do that. The to-do list guides the rest of the day in terms of activities. Review their information that needs to be entered into the system, take their blood pressure. They'll enter that reading. If it's out of range, that may be something that they notate, and that may create an alert. Medication, they have to make sure medication is given appropriately and at the appropriate time and the appropriate dosage. And they would notate if there's anything unusual there. And they would also check off the fact that that medication was administered. Monitoring and communications is a very important component of that. We have strategic partners that we're working with where we've installed hardware in the home for monitoring and communication purposes. So that hardware is part of that monitoring. May issue alerts. They would see those. They can understand if that individual is active, their up and about activity. They can open up a communication panel. They can actually view cameras and then speak into the individual. Hey, mom, how you doing today? I'm feeling okay. Great. If there's been any alerts, they can view that information and clear that sensor data. There's bed sensors and there's chair sensors that indicate how active they are when they get up from the chair, when they get out of bed. And the system begins to learn about their profiles and their daily activities, their patterns. And that intelligence then goes into the system over time, helping to inform those alerts and notifications. We'll have a document center where all the most important documents are located, healthcare directives, a power of attorney, healthcare proxy, things like that. And critically, if there is an emergency situation or there is a requirement for an external consult, we've built in that connection, that collaborative relationship with UCM Digital, where the individual would reach out to them if they need to contact anybody for emergency services. But we have a triage system really built in because not everything is an emergency. That's part of the objectives is to reduce unnecessary hospitalizations, reduce unnecessary emergency room visits, reduce unnecessary physician's visits. So all those things will be accessible within the application. And then each individual user will be able to manage their own settings. The family members can determine whether or not what notifications they want to receive, depending on their level of interaction and responsibilities for care of that individual. So that's the process, that's the flow, that's what we call the responsible family member would do. Now we'll take a look at some of the screens and see what those look like. And that'll give you a little bit of a better idea of kind of how this is going to work. So logging in, again, we talked about that home screen. So there you see in a very visual, very accessible way, how that individual is feeling, what their current state is, the most important metrics that were taken at that point. What are their vitals in terms of maybe their heart rate? And you can always drill down into these areas for more detail. And the caregiver would then be able to take the measurements or readings that were required for that day. They can manage appointments, again, like we said. So again, very accessible. Tap on the calendar, enter a new appointment, modify a current appointment or cancel appointment. And then there's always the notes. They're always available so they can look back historically and understand and see what's been happening with that individual. And as we collect that health data, you see where there's a very dedicated area within the app where you can see the summary of what's going on with the individual. We see biometrics. Some of that's going to be in the future, but make sure the last dosage of medication was administered. If they need to have glucose readings, if they have to do heart rate, blood pressure, whatever the specific vitals that are required, you would see that reflected here. And this is also where you would access the ability to take additional measurements or readings. Access the audio-visual components, access the live camera, audio speak in. Again, these are where you would access those functions so that you can talk to that individual and see how they're doing. And then the medical notes would be here as well, always accessible. Again, scroll back in time, make sure everything was done, any specific notations that were made, anything that you might need to see and be informed about. And then assistance, again, so there's that emergency component where we first offer a triage process. Everything's not an emergency, but if they need 911, they call 911. They can do that through the app. We have a call center that's available for any sort of problem. The hardware systems have a fall detection capabilities that goes to a central station. Those calls are routed properly. So we want to make sure that they're reaching out to the right individual at the right time. Very critical part of the application to make sure they're getting the care that they need in an emergency.
Matt,
Yes,
I see someone raise their hand. Do you want to hold the questions till Al's done?
yes.
Okay.
So at this point in the pilot, we'll have a deeper integration with UCM and emergency capabilities down the road. But for the pilot, when there's an outreach or a need for emergency consultation or a general consult, they will connect through to UCM Digital, and they will speak to one of the emergency doctors on the phone, through their app, or through the web. So we'll have different options there, whatever's most convenient for them and whatever infrastructure they have within the home. So we'll take a look at what that looks like. So when they reach out to UCM, that's their product is called SAM. So whenever they seek emergency services, they'll go to urgent or emergent care, tap on that, and then there's the options available for tell us what's going on. Myriad number of ways they can get access to the proper information, or they can do a quick search. At any point, at any time, there's always this tap to request consult now. They can hit that and immediately be able to speak to live emergency doctor. But you see here, there's also this robust set of medical information. It's called Up to Date, and it's curated, and it's very accessible. They can simply go in there, research information. If their care recipient has a particular condition, they say, this looks a little worse than it did yesterday. There's no reason to create an emergency around that, but they can dig into this and get some more information and get some guidance. And they may read something that gives them some concern. Again, begin consult if they have a question. And they can just simply tap in and get a question answered. And that individual on the other end, that emergency doctor, will help guide them as what they need to do next in terms of next steps. So now just go into a little bit about each of the participants that we're working with in terms of our technology integration partners. And again, I kept talking about how we're being able to take those measurements, input that information about what's happening with that individual in the home. Is there a critical behavior that's being exhibited? Make sure they're taking their medication, enter in their pain levels, make a note about mental health, take the vital signs, and obviously record any sort of significant event that may take place. So that begins to structure and become our electronic medical record, our EMR. All the data that's being collected is being appended to that electronic medical record for that specific individual. Alarm.com and General Security are our partners for that hardware, those systems that get installed in the home. We see the WellCam, that's where that two-way conversation is enabled. We also have wearable pendants, fall detection capabilities. We also have fall detection capabilities from the motion sensor if they fall in the home, or they have their wearable pendant that will detect if they fall in the home. Alarm.com is continuing to expand the capabilities here and their hardware offerings. So it's going to be a growing ecosystem of capabilities in terms of managing that individual's activities in the home. Bed sensors that begin to understand their daily patterns for when they go to bed and when they get up. That helps feed the intelligence that will tell us, based on this pattern, something is out of norm, something should be we should be notified because of that situation. And then general just activity monitoring is provided by the hardware infrastructure in the home. So all this activity is being a continuous collection of data about that care recipient. So all the information that goes in from hospital systems, from those vitals and biometrics, from the UCM Digital when there's an incident, every time UCM is contacted, there's a session, and when that session is over, a record is created, a discharge summary is provided, that comes back to us, and that gets appended to the record. So maybe there's been a diagnosis of a new condition, and now we have that data as well. County EMS now is part of this. One of the issues we had is we didn't have visibility into whether or not an individual was transported, if there was emergency, if they went to urgent care. But now, because when they're transported, they're part of the UCM system, we get information about when that happens, and that goes into the care recipient data store. Remote patient monitoring, again, is something that we're implementing as well in conjunction with Columbia Memorial. So we'll have that data as well. So all that data is constantly being aggregated and collected. It not only is available to each of the systems, but that becomes available to other participating entities as well that are part of this pilot program.
So the data that's being collected is very valuable to the state. It's very valuable to the hospital. It's very valuable to the primary care physician. It's extremely valuable to the responsible family member. But we're also talking to CDPHP, MVP, Fidelis about building this into their systems, which would bring it down to the Medicare level, which would make it universally accessible. And we think that's really where it belongs. And that's the long-term goal, is to get this into Medicare Advantage plans and other private insurance and public insurance plans. That's the end of the formal presentation on the app. We've identified a number of barriers, and we know it's not going to be easy. So tech adoption is one, getting people to use technology, but the beauty of this technology is the senior doesn't have to touch it. The responsible family member will have an ability to control the technology and be getting the data fed to them through the app on their device, whether it be an iPhone, a Galaxy, or a tablet. So the senior is the beneficiary of the technology, the two-way video and all of those things, but doesn't really have to do anything with it if they're not able to do anything with it. They can if they are. We certainly have a number of disabled individuals in Columbia County who are high functioning, who could do a lot of this, use the technology on their own. So they would be able to do that and have the capacity to do that. Broadband is a problem. I saw a report recently that I've seen conflicting reports. 15% of Columbia County doesn't have broadband, something in that regard. I've heard higher estimates of the percentage of people that don't have broadband, but that's something that has to be addressed and is being addressed at the congressional level, the 5G proposal. And there are proposals in the current legislation to expand broadband and 5G capacity. This is a compelling reason to do that. And we think it has a direct tie-in to what's being contemplated and proposed in Congress. Paying for the service is an issue. So we're going to have a sliding scale. The top of the scale is people who have sufficient resources, income, and assets. They'd pay $200 a month to participate in the pilot, and that's a full bundle of technology and care coordination. And that's really offered to them at cost of what it takes to produce. And we're working with Medicaid, again, Medicare, but one of the big reasons we can do this is the HFA subsidy, which is going to subsidize people, including the people that are served by the Office of Aging. And we're using a sliding scale there so that people would pay what they're able to pay, similar to what's done now for the services offered by the Office of Aging. And the hardest part of all of this is finding caregivers. And every time we talk to somebody, they say to us, well, where are you going to find home health care aides? Are you going to provide the aides? We can't provide the aides any more than anyone else can. But the real premise here is we're going to find aides anywhere and everywhere we can, because that's what people do now. The difference is we're going to be able to help them and formalize that search and have resources for them to conduct that search, whether it's a neighbor, a child, a formal caregiver, a home health agency. The Office of Aging is actually going to have some home health aides coming into the system as well. And that's the holy grail, is finding those caregivers. So our care coordinators, Nora Barato and her staff, are trained and have access to all of the information and data to help families find the care in the community. And, it's different in New Lebanon than it is in the city of Hudson and across the county and across the state. So it's really unique and individualized to that particular household. So we're working on solutions to all of those barriers as we develop the pilot. working with the government and private sources and funding and other foundations that we're seeking grant money for to help with those other areas of the pilot.
Hey, Lou, we have several people lined up to ask questions.
Sure.
So I want to start with Brenda Adams.
So I have two questions. How involved does the responsible caregiver have to be? Do they have to be on site or would they be remotely as well? And related to that, I have a concern about a senior's ability to accurately describe their condition. I mean, having cared for an elderly parent, when she goes to her GP, everything is fine, but it's not fine at home, but it's fine when she talks to him in his office. And my second question is, what about HIPAA? How are we getting around HIPAA? If we're sharing all of this information, how are we sharing it?
Sure. I think there are three questions there.
Sorry.
That's okay. The remote family member could be in Tokyo. They could be anywhere in the world.
Okay.
And they'll have the ability and capacity. That's the beauty of this. They will have all the tools to manage this case from wherever they are. And it can be multiple remote family members. You could have 3 children, all of whom would be in the system and all of whom would have the capacity to get data information and participate in the care plan. I'm going to kick it to Nora for the second part of that question with regard to getting individuals to come clean and give us accurate information. It's an issue for everyone. Nora is a clinical social worker. Nora?
Yeah, your question is a good one. And the thing that I can tell you is I've had a lot of experience going into people's homes. Older adults especially are very guarded because they're afraid of losing control. And so they're very mistrusting, and rightfully so, because usually when they go to the hospital, they're told, oh, you can't care for yourself, you need placement. So it's a process. And I have to emphasize that from the minute we get a call, we're developing that relationship and we're saying, what is it that you want? All right. A lot of older adults will say, I want to stay in my own home. I'm going to go feet first. All right. So we want to do that. We want to work with them and we let them know and educate them and the caregivers about what the barriers are. And what we look at is a short-term plan and a long-term plan. But here's the difference. Family members are so overwhelmed, and what we're asking them to do is beyond what we would ask anybody. You know, we're asking them to be the medical provider. We're asking them to be there 24/7, and we're asking them to continue on with their family lives and the work life. So what we do, the biggest thing that we do is provide that ongoing guidance and support. And the biggest thing that I can say is the automated tools help us support them and help us educate them as to when you really need to contact us and when we need to get outside help. And that process, once they know that we're not just going to up and leave them and we're going to be there and guide them through the process, they really rally for their loved one because they want to see them in their own home.
Nora, quickly, HIPAA compliance.
In terms of HIPAA, what we do is I do not talk to anybody without their written consent. And there's 2 forms of HIPAA. The HIPAA, the general consent is, I would say, is it okay if I talk to your doctor and they say, yes, all right, I send a consent out for them to sign and they specify who they want for me to give information to. In New York State, there's a second level, and that's for HIV, patients, substance abuse, and mental health. You have to get a specialized consent. And so that's a New York State form, which we will request that they can sign. If they don't want to sign, then we will not be able to share that information.
Matt?
Thank you. Supervisor Chimides.
Yeah, thanks for the presentation. I just wanted to follow up on the HIPAA questions because I'm less familiar with HIPAA. Is if someone signs the consent for HIPAA, is it can the information be like, can they control which third parties the information is shared with? And do you anticipate sharing the data with any for-profit ventures? And do you anticipate selling any of the data? And would participants be protected from either one of those?
Absolutely not. The client has to give us permission, and they have to be very specific who we can share the information with. And we will only share it with the people they authorize. Now, if there's a question of their capacity, that's where we would go to the healthcare proxy or the appropriate party that has that legal ability to represent them.
Okay, thank you.
There's no secondary market for this data.
Appreciate that.
Matt?
Supervisor Holtling had her hand up.
I'm sorry, Supervisor Holtling?
Yeah, so for the interest of time, I have 5 questions, but they're all yes or no questions. So I'm hoping for a yes or no answer. And then if we have time at the end and you want to elaborate. So I think this is a wonderful program. Thank you so much for the presentation. But since telehealth is the way of the future, I'm wondering, is Everhome the only company currently that offers these services?
So the answer is no and yes.
Okay.
Telehealth is widely available. The telehealth provider that we've contracted with, United Concierge Medicine, is in MVP policies, they're in CDPHP policies, they're national. But no one has the app that we're developing that integrates all of the various technologies. That's the unique feature of this pilot program.
Okay. So really the answer is no. Nobody offers the same thing that you're offering.
Correct.
And so my second question might be a moot point. I wanted to know, did New York State go through any sort of vetting process to choose Everhome for this pilot program? I'd assume the answer is they didn't need to because there's no one really else to vet. Is that
Yeah, Greg has pilots all over the state, and he gave a presentation to the Health and Human Services Committee. They're funding pilots all over the place, and they've not seen anything close to this.
Okay. And then my second question is, my understanding from talking to the chairman, I just want to confirm, there is no contract between the county and Everhome. The contract is between New York State and Everhome, and we are simply getting the services.
Correct.
Wonderful. And then my last question is, if New York State is funding the first year, and then the Home for the Aged is giving $350,000 the first year, and then $150,000 in the second and third year, and then I hear a sliding scale with $200 a month at the top, is that really $200 at the top from the person getting it plus $350,000 plus what New York State is giving you? Is that really the operating expense
No.
of this program?
If you look at our pilot summary, we want this to work across the spectrum of consumers, of people in their homes, everything from Medicaid patients who don't have any income or assets, all the way through to high net worth individuals who could afford this 10 times over. So people who can afford to private pay will pay $200 a month for the services of the pilot. People who have nothing will be looking to Medicaid to do this, and people in between, which are mostly the population of NYSOFA and state and county office for aging clients, have some means, but not enough to private pay. So they would contribute something towards the cost of the pilot. The balance is what's going to be subsidized by the Home for the Aged. That's where the HFA funds come in, is to take that whole middle band of consumers and allow them to participate. New York State Office for Aging money is not coming into the pilot at all. It's going directly to the County Office for Aging, simply for their additional resources that may be necessary for them to participate in the pilot.
We lost Supervisor Holtling. Supervisor Guzzi has his hand up.
Yeah, is the app that you guys are developing, is that going to be sold or leased for profit, the app itself?
The app is being developed by Apollo Care LLC, which is a for-profit company. But
So there is going to be profit out of that then, out of the app?
hopefully in the long run, yes. This is, the pilot is the test ground for the
this app. Okay, so they're developing an app out of it. And then you say about doctor on staff. I mean, it seems hard enough to get into a doctor's office now or even talk to them. Is the plan to staff doctors, or is the plan that you contact your local healthcare provider who's your primary physician?
So I'll take a shot at that one because it's a good question, and I'll see if Alan and Nora want to weigh in. What we're offering is telemedicine, and it's 24/7 on-call emergency room level physicians that are currently part of United Concierge Medicine. They offer this service across the country. So they provide the doctor via telemedicine. We will then loop back to the patient's primary care physicians. Those are the social workers that we're working with, to interface with them so that the primary care doctor can participate. They're also already doing telemedicine. The primary care physicians in the Columbia Memorial Network are doing telemedicine now. So telemedicine is a big piece of this. So people don't have to displace. A lot of people are homebound. A lot of people can't get out, don't have transportation. So the medical visits come right into the home via telemedicine. Certainly, if they can get to the doctor, transportation gets provided by a variety of sources in Columbia County for medical appointments. That can all be coordinated through this as well.
Thank you.
Supervisor Mussman.
Yeah, can you just restate how many Office of Aging people you expect us to recruit? Just remind me again of that number.
So,
And this is for 1 year, correct?
18 months is the pilot. So we're looking at getting 200 people serviced by the Office for Aging, either who come in their door and agree to be referred, or who come in our door, who we would then reach out and refer to the Office of Aging.
And then after that, what is the plan?
The plan shortly, and hopefully before that, will be to get this picked up in both the Medicare and Medicaid programs so that it would be a universally available service through primary care as part of a primary care proposition. The broader picture is value-based billing for medical providers, and that's why the hospital is so interested in this. They actually get paid to reduce healthcare costs now. They get value-based payments, and they want to increase their value-based payments, which means they have to decrease the hospital admissions and readmissions in patients who have chronic illnesses. That's a big part of the motivation for them to work with us. Once we get to that point where it's proving out the viability and the efficacy, the insurers are the ones who benefit. So they're the ones that would be the adopters, the Medicare and Medicare Advantage plans, who would bring this into their primary care so that they can bring the cost for these patients down. And we know that proves out. It's proven out in every other model. Telemedicine has proven that out as well.
I'm going to have to cut this off now. I just want to thank Lou Piro and his people for this presentation.
Thank you.
And I also want to thank the supervisors for, we had a good, a pretty good attendance from all the supervisors. So I'm glad, there's interest in this project.
I just want to point one other thing out, Matt. In addition to the website, it's everhomecolumbia.org. Alan has a test facility. You're all invited. If you want to see it actually in place, the hardware and how it's operating, we have a test facility in Latham that you're welcome to visit. Just let us know, and we'd be happy to make arrangements for that.
Love to have you.
Thank you.
Thank you.
Thank
All right. Thank you all.
to open the county government meeting, special meeting here tonight. I need a resolution. 369 is authorization to appoint a member of the Climate Smart Community Task Force.
That's me, Planning Patrice. So the person's name is Matthew Stinchcomb, and he is representing the Climate Smart Committee. He is from the Climate Action Partners of Hudson Valley, Partners for Climate Action Hudson Valley.
I'll make the motion.
Second it. It's from
All in
Gallatin.
favor?
Aye.
Opposed? Carried. Okay, the second resolution, 370, is a resolution
Thank you.
approving the premium equivalent rates for the 2022 county health insurance program.
Good evening. The subcommittee of the, well, as you know, we're going to be going out for RFP next year for our traditional health insurance. But every year at the end of the year, we take a look at what the premium equivalents presented from our insurance company and through our insurance broker to take a look and see what premium equivalents we would need to have to set for the next year. So through this and with the recommendation from CDPHP and ProAct as our pharmacy provider, they are suggesting a modest 5% increase. Looking at New York State's averages, they're looking at anywhere from a 5 to a 7% increase, with some of the smaller companies looking at much higher than that, even higher. So we're looking between the reserve, between COVID costs, between certainly increased pharmaceutical and prescription coverages. The health insurance subcommittee was making the recommendation for the 5% increase, which is what is reflected in those premium equivalents in the resolution.
Anybody have any questions?
I'll make that motion to approve that.
Need a second?
Second, Bury.
All in favor? Opposed? Carried.
Thank you.
Okay, I think that's all I have.
That's it.
Motion to adjourn.
I'll make it.
Second,
Second.
all in favor? Good night.
Aye.
Aye.
Thank you.
See you in a minute.
Yep.
Cocktails.
Special Finance Committee meeting to order. Do you want to do the 370 first? It doesn't matter, right? There
Did
we
it
go.
switch?
Yeah, we got it.
Okay,
Great.
okay.
So we're going to do resolution number 369, 2021, authorization to appoint a member to the Climate Smart Community Task Force.
Move it.
Second.
Debbie.
Motion and second. Sarah, all in favor?
Aye.
Opposed? Carried. Okay, resolution number 370, 2021, resolution approving the premium equivalent rates for the 2022 county health insurance program.
I'll make the motion. Burrell.
Sterling, second.
We have a motion and a second. All in favor?
Aye.
Aye.
Opposed? Carried. I think that's about it, right, Kelly?
Yes, sir.
Okay, motion to adjourn.
So moved.
Second.
All in favor?
Aye.
Okay, now we can go to the other link.
Okay,
Bye for real.
see
Thanks,
everyone
everyone.
shortly.
I'm going to call the Board of Supervisors meeting to order, and I'd like to rise and take a moment for silent prayer, followed by the salute to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, under God, indivisible, with liberty and justice for all.
Oh,
Okay, I'd like to request the clerk call the roll.
Basson,
Here.
Weigelt,
Here.
Leader,
Here.
Benvenuto,
Here.
Stats,
Here.
Adams,
Here.
Metler,
Here.
Collins,
Here.
Riley,
Here.
Eldridge,
Here.
Fury,
Here.
Kirsten,
Here.
Ligonia. Supervisor Ligonia. Sterling,
Here.
Mia,
Yeah.
Chemidas,
Here.
Mussman,
here.
Scalera, Guzzi,
Here.
Holding,
Here.
Morel,
Here.
Not,
Here.
Skoda.
Present.
$33.66 present, 169 absent. We have a quorum.
Okay, thank you. I need a motion to pay the bills, accept the treasurer's report, and file the minutes within the clerk's office.
So moved. Second the motion.
All in favor?
Aye.
Opposed? Carried. We have a brief presentation that's going to be done by Sheriff Bartlett. Sheriff?
Just trying to get off mute there. Okay, can everybody hear us okay?
Yes.
Yes.
Okay, I want to introduce Peter Kehoe, Executive Director of the New York State Sheriff's Association, and he's going to start with the presentation in reference to our Civil Accreditation Award, and then I'll speak after Peter speaks.
Thank you, Sheriff, and thank you, Chairman Moreau, Public Safety Chair Benvenuto, members of the Board of Supervisors. It's my pleasure to be here today on behalf of all the sheriffs of New York to recognize and honor Sheriff David Bartlett and the men and women of the Columbia County Sheriff's Office on the occasion of reaccreditation of the Sheriff's Civil Division. Only 26 of the state's 62 counties have been able to achieve civil accreditation, so obviously that's not an easy accomplishment. In addition, your Sheriff's Office maintains accreditation of the Jail Division, the Court Division, the Court Security Division, and the Law Enforcement Division. These are all significant achievements by themselves, and they clearly demonstrate the commitment of your sheriff and your sheriff's office to the pursuit of excellence in their profession. You have an outstanding sheriff and an outstanding sheriff's office, which are well respected here locally, as you know, but also throughout the state. This Board of Supervisors and the citizens of Columbia County should be very proud of their sheriff and the sheriff's office. Tonight, we particularly want to honor the achievements of the civil office employees. To my mind, the unsung heroes of the sheriff's office. Many people don't even really know the important role that our civil officers play in our justice system. Those officers are responsible for the enforcement of the orders and judgments of the civil courts. And without these dedicated men and women to enforce them, those orders and judgments would be just mere pieces of paper. Everyone knows the dangers and difficulties our road patrol deputies face every day. Not everyone knows that the work of a civil deputy can be just as dangerous and just as stressful as that of a criminal law deputy. Too often, angry litigants take out their frustration with the civil court system on the deputy who is just doing his or her job, serving and enforcing the orders of the court. Without the dedication and good work of our civil deputies, our courts of civil justice could not function. And that is why we seek to foster excellence in sheriff civil offices through our accreditation program. Civil accreditation is not something that's available just for the asking. To achieve accreditation requires a civil office to meet a very stringent set of standards and best practices which have been developed by experts in the field of civil process. These standards currently have 121 individual components, and the civil office must submit itself to scrutiny by an outside independent board of assessors, which reviews the agency's operations in detail to ascertain whether or not it meets these many demanding standards. And I'm happy to report tonight that the Board of Assessors, which reviewed the operations of the Columbia County Civil Office, has found that it meets or exceeds every one of those standards. So congratulations are in order for Sheriff Bartlett and the men and women of the Civil Division and all the men and women of the Columbia County Sheriff's Office for this accomplishment. And I want to say that congratulations are also in order for the Columbia County Board of Supervisors and for the citizens of Columbia County. For without your moral support and your financial support, this achievement tonight and all the outstanding service provided by your sheriff's office to all the citizens of Columbia County in all the areas of sheriff's responsibility just would not be possible. Now, of course, accreditation does not just happen. It takes a lot of hard work by a lot of people, and the entire staff of the sheriff's office deserve to be recognized and applauded for this achievement tonight. But I particularly want to recognize a few individuals who devoted a great deal of extra time and effort to managing the many administrative and operational details required in order to successfully demonstrate that the Columbia County Sheriff's Office is most deserving of this recognition. So I want to recognize Lieutenant John Rivera, who's not here with us tonight, but he began the work on this accreditation project. So we want to thank him and congratulate him on this successful effort. But the project was then picked up by Ian Boehm, I think, is that right, Ian? Yes, come forward, Ian, please. Receive this certificate of recognition for all your hard work. And thank you for your hard work and successful work in this project.
Thank you very much.
I also want to recognize Civil Clerk Michelle Donnelly for all her work on the project. Michelle, congratulations to you.
Thank you, Sheriff. Thank you. Thank you.
And Civil Clerk Deborah Lombardo. Deborah. Congratulations to you. So again, I want to thank you, Chairman Morrell, for this opportunity to publicly acknowledge all the good work your Sheriff's Office is doing for the citizens of Columbia County. And that at this time, I'll ask Sheriff Bartlett to accept on behalf of his entire staff this plaque commemorating this achievement today. Sheriff, congratulations to you and all your staff.
Thank you, sir. It's a true honor. For people that don't know about accreditation, it's a lot of work. It brings and shows the community how truly professional this agency is. As Peter said, roughly 1/3 or a quarter of the 62 offices in the state of New York are accredited. There's a little bit more for corrections. There's a little bit more for law enforcement, but at the end of the day, it's not 100%. And it's showing that our policies are up to speed. Our policies are good enough to get through this process, but I can actually speak, and I believe you can also correct me if I'm wrong. When we spoke to the assessors, I spoke to Sergeant Grassi, and he was one of them that came, and he says this was one of the best ones that they had seen in the entire state of New York. Surround yourself with great people. I couldn't do it without Michelle, Deb, and Ian, without John. These people pour their heart and soul into this program, and they're the true heroes of this. Speaking from a accreditation manager standpoint, because I was the one for law enforcement, it is a lot of work. It's a lot of work. It's a lot of keeping up on records. And I want to thank you, the board, for allowing us to, again, do this type of work. And again, accepting this award on behalf of the citizens of the county and as well as all the staff here. So, Mr. Chairman, I can say, and Chairman Benvenuto, that just please understand that the men and women here are doing their job. They're doing it great. And you have a true, very well-maintained office. And I'm very, very proud of all the people that work here.
Thank you, Sheriff. Supervisor Benvenuto.
Yeah, I just wanted to state that, we brought up the importance of accreditation for the Sheriff's Department during our local police reform process. So I just want to express congratulations to the sheriff for this latest honor and also to the employees of the Columbia County Sheriff's Department. Very good.
Thank you, sir.
Thank you. And Sheriff, I want to congratulate you as well and your staff, and thank you for this presentation.
Thank you, sir.
Thanks.
Have a good evening.
Take care now. I'm going to ask the clerk read the resolutions.
Okay, resolution 334 of 2021 to 345 of 2021 by Supervisor Sterling.
Mr. Chairman, I offer these resolutions for adoption.
Second the motion, Basson.
All in favor?
Aye.
Aye.
Opposed? Carried.
Resolution 346 through 352 of 2021 by Supervisor Weigelt.
Mr. Chairman, I offer these resolutions for adoption.
Second the motion.
All in favor?
Aye.
Opposed? Carried.
Resolution 358 of 2020, I'm sorry, 353 to 358 of 2021 by Supervisor Bury.
Chairman, I offer these resolutions for adoption.
Second the motion.
All in favor?
Aye.
Opposed? Carried.
Resolution 359 through 362 of 2021 by Supervisor Stats.
Chairman, I offer these resolutions for adoption.
Second the motion, Basson.
All in favor?
Aye.
Aye.
Opposed? Carried.
Resolution 363 through 370 of 2021 by Supervisor Knott.
Mr. Chairman, I offer these resolutions for adoption.
Second the motion.
Favor?
Aye.
Opposed? Carried.
That's it, Chairman Morrell.
Okay. Somebody's got some music playing. I just want to say that before we adjourn today, I'm gonna ask to go into executive session so that our legal counsel can brief us on negotiations. But before we do that, I'm gonna ask if any supervisors has any business to bring to the board. Okay, well, I actually have some business to bring to the board. And I'd like to read a statement. I am pleased to report that based on the analysis of our finance team of Treasurer PJ Keeler, Controller Ron Campanera, Finance Committee Chairman Jim Guzzi, and myself as Budget Officer, we are currently seeing projections that inform us that the 2022 budget will bring us a tax decrease. As things currently stand, the tax levy decrease will result in a county tax rate decrease to county taxpayers. It's important to realize at this time that with 2.5 months remaining in our fiscal year, we base our projections not only on current trends, but also historical trends. At the same time, in between meetings, we continue to look at the numbers. We are guided by the county's general fund balance policy established by the Board of Supervisors Resolution 114 of 2018. The policy was adopted based on historical county financial performance, assuring that Columbia County maintain its financial strength moving forward to assure we are able to meet our current and future financial obligations. Because of the time remaining in 2021, we are not releasing numbers relative to the projected decrease tonight. But should the year finish out as we've seen in past years and how things look today, I think we'll have very good news for county taxpayers in their 2022 budget bill. I'm sorry, tax bill. Thank you. So I would entertain a motion to go into executive session to talk about contract negotiations.
Motion.
Motion, Mike Benvenuto.
Second, Adams.
Second, Supervisor Adams. All in favor?
Aye.
Aye.
Opposed? Carried. I'd like to have Elena DeFeo-Keen, our labor attorney, brief the board.
Oswaldo, were we cut off?
Thank you, Oswaldo. One thing I just wanted to bring up as well is, because I've heard, we've seen it on the news, and I've heard from different employees about premium pay in Columbia County. I just want to assure the Board of Supervisors that the budget work group is working on premium pay with our labor attorney as well as Michael Reardon. And we will hopefully shortly be coming out with a plan for premium pay. So we had all of our department heads fill out questionnaires, which they did. So we should be moving forward. Actually, I believe this Friday, we're going to be looking at some actual premium pay numbers. So, okay. With that, I need a motion to adjourn. Oh, excuse me. Linda, Supervisor Mussman?
Chairman, I understand that if you need a test for COVID, that we don't have any tests available at the health department. Is that true?
I don't believe we do have tests available. We don't have an abundance of tests, but we're actually looking at purchasing more tests. We agreed through the EOC group that meets every week that we would purchase test kits with the money that has been donated to, for COVID.
I know, because some people have asked me about that. They've been asked to get tested, but when they go, they have to go to a hospital and then they're charged for that test. So I just want to make sure that our website is clear about the finances behind the test, if it's free or not free, or so that's confusion. So.
Yep, it's like I said, there's a limited amount of tests. If people are not showing symptoms, I know that they're being referred to places like WellNow and other places. But if they are showing symptoms, the health department will test.
And that one's free or not?
WellNow, I believe that goes towards insurance. Your insurance is charged, I should say.
Okay, anyway, that somebody had been asking me about that because they were surprised that they were charged for the test.
Mm-hmm.
So I just trying to make it clear on our website what's the how that works. So
okay, we can Supervisors Ligonia, Hoatling, and Sterling. We can talk about that at our next DOC.
Yeah, and just to reiterate what you said, I know with some school quarantines, the people are being quarantined, but the health department just doesn't have enough tests to test everyone that was potentially exposed. So they are waiting, like the chairman said, for symptomatic individuals to utilize their testing. But there are definitely many other locations. And in my experience, I have not been charged, although I have been tested even without symptoms. So there are other locations that people can go other than the health department, but the health department is just for the symptomatic individuals.
Supervisor Adams. I'm sorry.
So I just wanted to add to that. Wellness Now has had some time restrictions associated with testing. I've gone twice now for a medical procedure, and they were unable to provide tests because they were not able to take any more appointments that day. So I would really suggest that people call in advance before they go to any of these locations, because it's not easy to get a test.
Thank you. Supervisor Ligonia?
No, I was going to say the same thing. The test kits are not readily available. If I'm not mistaken, they cost us $42 a test kit.
Yes.
And they're not readily available anywhere. And as Supervisor Adams said, it's not easy to get a test. And there is specific criteria at the county, since we don't have an unlimited supply of test kits as to, who they're testing. That's all. So we did authorize them to purchase more. I don't know where we're at with that at this point.
Yep. Okay, anything else? Okay, a motion to adjourn.
Motion.
Second?
Second.
Good night, everybody.
Supervisor Guzzi, all in favor?
All right.
Opposed? Carried. Thank you all.
Hi, everyone.